Good afternoon, everybody. This is the teaching video for mother and infant discharge. So to begin, the nursing situation that was encountered, in all honesty, was not the greatest discharge that I've ever seen. I feel that it was rushed, to say the least. There were many things that the nurse said that didn't need to be said. I think probably one of those most important things is when she came in toward the end and said, well, it's gotten really busy out there, so I'm going to get through this quick, and you let me know if you have any questions. It was really obvious that that young girl had no idea what was going on or what was important when it came to the safety of herself and her child. She gave quite a few clues that the nurse seemed to just ignore, especially when she says, these are a few things that we give new moms to take home. And the patient says, I don't have a home. And the nurse is like, okay, well, let's keep going. I don't know how much more of a clue you need to have. That statement alone should have been cause for more probing questions to find out what that patient's home situation really was. To go back to the articles that we had to read in preparation for this, the one I think they all pertain to this situation, but in particular, the article regarding the study, the transcultural study with homeless people, that was a very interesting take. It's something that I had never considered, that homelessness could be considered a culture. After reading the article, it's almost so simple that you wouldn't think of it. But after reading the article, I realized homelessness is definitely a culture. It fits all of the definitions of culture. They have their own lingo. They have a certain style of dress. And the people that they interviewed for the article even had similar attitudes regarding using healthcare and primary care doctors. In regards to this situation, the nurse was not culturally competent to that patient regarding her situation for going home. I don't feel that she was particularly compassionate about it either. She almost seemed indifferent to it, or a little cold even. I'm just going to look at I have some excerpts from the articles here. So regarding compassion, this is from the Margriet van der Siegel article on compassion. She says here in the article, compassion is a motive for many healthcare workers. They are motivated to do their job because they know suffering exists and they want to do something about it. She also says compassion means setting aside one's own interests, values, and judgments, and not giving judgments on the possible guiltiness of suffering. Compassion asks people to make a choice to acknowledge the suffering of others. I think just those three excerpts hit home when it comes to why I became a nurse and why any of us do what we do. I don't think that the nurse in the video exhibited any of those things. And she should have, because, again, it was really obvious that that young girl needed a lot more than just a quick 5-minute teaching session on how to take care of herself and her child after discharge. Perhaps that nurse would have to go through something like this article where they did the poverty simulation. This showed that after going through the simulation, the students who had to exhibit poverty and had to exist in that state of poverty had a lot more compassion for living in poverty and recommended resources and changed the way they provided nursing care based on that. That almost seems like a perfect fit for the nurse in the video. And then the other article that we had to read here regarding compassion, and went through some of the definitions of compassion. And it talks about compassion revolves around the way in which people relate to each other. It's not so much about what people do for each other, but what they choose to do together. In that compassion has reciprocity and interdependence on a relationship between two people. I think this has a lot to do with what's going on in the video. There is clearly no relationship between those two people. There is no reciprocity. The nurse and the patient are coming from two different ends of the spectrum. The nurse has the job of finding a way to do an assessment that will elicit information from the patient. Although I think it was pretty apparent that compassion was needed, that nurse needed to probe deeper into the patient's situation to find the compassion for that patient. I don't think she automatically had compassion for that patient. So just in the first few minutes here, I've covered how I feel about this simulation. I don't feel that proper nursing care was delivered. I don't feel that that patient's best interests were served by the nurse. As far as experience I've been in healthcare for 20 years. I've helped, at this point, probably a few thousand people with their care, from being a certified nurse's aide all the way up to now being a registered nurse, and into the future as being a nurse practitioner. I have no doubt that I will touch the lives of another few thousand people. Just in that time, I've been in many situations and many different scenarios with patients. And I have met people, not exactly like this girl, not a new mother with a new baby, but I have taken care of homeless people in the past. I never judge people for the way they live or where they come from, whatever walk of life they come from. My main purpose is the care of that patient and to ensure that they understand what they need to do to continue to care for themselves when they leave the hospital. In the case of homelessness, you're going to have to use resources. You're going to have to get that social worker involved and say, what do we have for this person that will enable them to take care of themselves? In Richmond here, we have clinics that serve the homeless community. They can get care for a reduced fee, or even, the fan-free clinic has free care. There has to be other resources out there that you can give to a homeless patient. A quick story, I grew up in upstate New York, excuse me, and I used to hang out at a club in downtown Albany. There was quite a few homeless people who used to hang around there, but there was one in particular. His name was Dean. People used to make fun of him and berate him for being homeless. There were a handful of us that actually talked with Dean and got to know Dean. It turns out Dean has a doctorate in physics. He used to work at Rensselaer Polytechnic Institute, RPI. It's a pretty well-known school. And he was a professor of physics. Brilliant man. Absolutely, just incredible. He fell on hard times. He was married. He had a wife. He had 3 children. Fell on hard times, started drinking, became an alcoholic. His wife left him. His kids didn't want anything to do with him. He lost everything. He ended up on the street. And that's where he'd been for, when I knew him, he'd been on the street for 10 years. So who are we to judge? This is a man who came from a very good situation. He has an amazing mind. He's intelligent. He's educated. Yet here he is, living like a vagrant. And, never knowing where his next meal is coming from. Spending all his money on liquor and sleeping on the street. So it just goes to show you never know what life is going to deal for you. You could be on top of the world one day and sleeping under a bridge the next. So back to the video here. Emotionally, I watched this video and I just kind of shook my head the whole time going, that's not right. What is this nurse doing? This patient needs help. And it made me feel bad and have even more compassion for that patient because I knew she wasn't getting the care she needed. I knew that once she got out into the real world with this baby, just a horrible situation. And it makes my heart hurt that somebody could go through that. I think I've covered a lot here, but initially with that situation, like I said earlier, right from the get-go, it's pretty obvious that that patient needed a lot more help, and the nurse wasn't providing the assistance that she needed to. And I was really curious as to why social work was not mentioned or seemingly involved in that situation whatsoever. That should have been one of the first things that happened as soon as that girl came into the hospital. She should have been set up with a social services consult. I'm just looking over our guide for reflection here. Looks like I've covered most of everything here just from talking for the last 13 minutes. Just to, I guess, go into a conclusion, the psychological well-being of that mother, I think, definitely needs to be questioned. Excuse me. It was stated by the nurse that the girl has a history of drug use. And then again, with her not having a place to go, one has to question, is she fit to be a mom for a newborn? And I hate, and that sounds kind of horrible to say that, but we have to look, she's young, this is her first child, she has a lot of outside influences that can affect her judgment. And we don't know exactly where on the timeline of drug use she is. Excuse me. Is she a former drug user, current drug user? I kind of got the impression that she was a current drug user. So I think she needs to be taught, look, you can't use drugs while you're breastfeeding your child. There are many drugs, especially street drugs, that are going to pass through the breast milk to the child, and that's going to pose a threat to the baby's health. And then, down the road, it could affect the baby's brain development. So we have to look at, is the mother psychologically ready to handle the situation of having a newborn baby, and does she really know what she has to do to care for the baby? Along the child care lines with the diaper change in the video, the mother didn't ask any questions. It was fairly obvious. She said, "Is the baby cute?" That really has nothing to do with what the nurse was trying to tell her or teach her. So, again, we have to bring into question, is she psychologically sound? Does she know what she has to do to care for that child? I would say no, and I would have really questioned the discharge. I wouldn't have let her walk out of that building without at least getting the social worker in to talk to her before she left, and possibly even calling the doctor and saying, what can we do, because I don't feel safe discharging this patient. She really needed resources. She needed to know, where can a single mom go with a newborn child? Are there any halfway houses? Are there any shelters? Get her set up with WIC. How's she going to feed herself? How's she going to feed the baby? There's so many unanswered questions and so many aspects of this that were not taken care of. Sorry. So my goal for this patient would have been a lot of education, a lot of help as far as resources that were available to her and within the city of Richmond, and really just making sure that she understood what childcare entailed. The nurse definitely should have been doing teach back method. She should have had that mother demonstrating and reciting, this is what I do, this is what I don't do. Being that it was not a real situation, that makes me feel better. But had it been a real situation, I really would have just been praying for that mom and that baby, because I'd be very, very worried that they were not going to make it. So that's my thoughts on this video. It's been a good semester. Thanks for all your support, and you guys have a good day. Thanks very much.